I would like to introduce the Austin Regional Dean, Dr. Cheryl Perry, who will introduce our speaker today.
Thank you, Brooks. Very excited and honored to introduce Dr. Michael Eriksen, a long-term colleague and friend. As many of you know, he is currently the Dean of the newly established School of Public Health at Georgia State University. That became a School of Public Health in 2012. And prior to that, he was the director of the Institute of Public Health at Georgia State and actually worked to create that institute into a school. He received his bachelor's, master's, and doctorate from Johns Hopkins University in the School of Hygiene and Public Health. He's had a very long and distinguished career in public health, serving for the World Health Organization as a senior advisor and being the longest-serving director of the Office on Smoking and Health at the Centers for Disease Control and Prevention from 1992 to 2000, where he developed a lot of tobacco control policy for the U.S. He also served as previous director of behavioral research at MD Anderson Cancer Center, so he's not a complete stranger to Texas, which we are happy to share Austin with him today too. So in addition, right now, Dr. Eriksen is the principal investigator of the Georgia State Tobacco Center for Regulatory Science, funded by the National Institutes of Health and FDA, and he also directs the Georgia State Partnership for Urban Health Research and the Center of Excellence on Health Disparities Research at Georgia State. He has had many awards and recognition for his extensive work, and so needless to say, we're really honored to have Dr. Eriksen with us here at Austin and to present this webinar this afternoon. So looking forward to hearing about e-cigarettes, and I'll take it over to Dr. Eriksen.
Thank you, Cheryl. This is an honor for me to be here and to return to Texas, where I spent 6 good years at MD Anderson and the UT School of Public Health in Houston. And as Cheryl mentioned, I've left Texas to go to CDC to head up the Office on Smoking and Health as it moved from Rockville, Maryland, and part of the Office of the Assistant Secretary to CDC in Atlanta. And during the 90s, I say it was a very active time in tobacco control with a combination of investments in state and local and global tobacco control, as well as the efforts at that time of the FDA to regulate tobacco products, and a lot of litigation, including the Master Settlement Agreement. And in many ways, that time was the most energetic and exciting time in tobacco control, only to be continued today, where I have to say I'm surprised that there's as much energy and excitement and controversy around e-cigarettes, and a day can't go by without reading a headline in the newspaper about e-cigarettes, whether they're harmful or helpful. And even this week, as an example, you've seen articles, headlines in papers about estimate that 4% of U.S. adults use e-cigarettes on a regular basis, and also the headline that flavors are important in kids' decision to use e-cigarettes. So it's a constant outpouring of information. Much of it's contradictory, and also much is unknown. And in that context, public policy needs to be made, and smokers need to be given guidance. So it's a very exciting time, somewhat unparalleled in terms of the opportunity to investigate, recommend, and make a difference. So today what I'd like to do is to review some of the evidence of what we know and some of the challenges going forward, and very pointedly, what should be the public position and the health professional position on e-cigarettes, knowing that we don't have all the information, but people are using the product widely. It's a multi-billion-dollar industry, and we have over 40 million smokers, which contribute to untold harm. So let me begin by starting with a disclosure that our group at Georgia State, we do receive funding from NIH, both from the Institute of Minority Health and Health Disparities, as well as NIDA, as Cheryl had mentioned, to fund our TCORS. And we also receive funding from Pfizer to do work in China to begin to change social norms and make non-smoking more of a priority in a country that has more smokers than we have people in the United States. I also like to say that my comments are not reflective of the views of either the NIH or the Food and Drug Administration. While much of the research is funded by them, that my comments do not reflect their official position. And that we have a very strong team back in Atlanta of faculty and trainees and fellows who are working full-time on trying to advance our understanding of this issue and to fulfill our responsibilities with the TCORS funding from FDA, and to advance our understanding of these products and what we should be recommending as next steps. So let me quickly review the objectives that I have for this webinar, and each of these will be covered very briefly, particularly those that are obvious. But to start by just recognizing the harm caused by tobacco use and understanding that most of this is due to combustion or smoke, and that e-cigarettes could, underline could, play an important role if they increased cessation among smokers, but we need to be cognizant, and the FDA needs to be very cognizant from a statutory standpoint, that their obligation is not to look at individual benefit, but to look at population health benefit. And simply put, if more kids started smoking because of e-cigarettes, or other people didn't quit smoking because of e-cigarettes more than the individuals who quit, there may be a population harm, and in that case, the regulations need to take that type of consideration into account. And then lastly, just from a practical standpoint, we want to begin the conversation about how health professionals, particularly physicians, should counsel their patients around e-cigarettes. Right now, most smokers want to quit. They've tried and failed, and physicians are unclear as to what they should tell their patients, and they're also, the smoking population is really unclear as to whether these products are recommended for cessation. We do know, and the data that came out this week confirmed, that the majority of e-cigarette users continue to smoke. So it's very unclear what the evidence is about their role in cessation. However, the importance of cessation and doing something proactive about getting as many people to quit smoking as soon as possible can't be denied. So just a few slides on the harm. This is a global issue. Over 6 million deaths a year due to smoking and tobacco use. And you can see that no part of the world is immune, with the greatest number of deaths occurring in the Western Pacific region. These are the WHO regions. AFRO and AMRO is the Americas region. We often refer to it as PAHO. AMRO is Eastern Mediterranean, European region, Southeast Asia region, and finally the Western Pacific region, which is dominated by China. So there are untold deaths, millions of deaths, and we project, and it's reflected in the Tobacco Atlas, that there will be 1 billion deaths in the 21st century if current trends continue. and that the majority of these deaths are the result of smoke or combustion, of burning an organic product, tobacco, and inhaling the smoke from that combustion repeatedly over decades into your lungs. And you can see, simply put, what a healthy lung looks like versus a diseased lung from a smoker. And there's no doubt that smoke is the primary villain with cigarette smoking and tobacco use. It's not the only one, but certainly is the one that causes the burden that we see. You can see harm in India and South Asia from high levels of oral tobacco use and oral cancer. So it's not exclusively cigarette smoke, but certainly in the United States, the predominant harm caused by smoking is the result of the smoke. And so how do we change the status quo? And this is a slide that was lent to me by my colleague Ken Warner at the University of Michigan. And simply put, the red line reflects the current projections. If we continue with the level of success that we've had in the past, projected out to 2050, and the blue line is the estimates if we were to reduce initiation and increase cessation by 25%, and the green line is as if we were to improve the status quo by 50%. And only by improving by 50% would we get into single digits of smoking prevalence by 2050. And even if we did that, we'd still have tens of millions of smokers. And many of us feel that that's not acceptable, given the harm caused by smoking and the fact that it's a leading preventable cause of death and that most smokers wish they never started and would like to quit. We need to do better than having tens of millions of smokers, most of whom would rather not. And so the issue comes up, and it's quite divisive, is that can novel nicotine products, particularly e-cigarettes or ENDS, electronic nicotine delivery systems, can they be a disruptive technology, and can they be used in a way that would advance the public health, or is it more like what happened with light cigarettes during the 70s, where a disruptive technology was introduced under the guise of causing less harm, when in fact it didn't, and it was, the companies were found guilty of fraud and, lying to the public about these products, which were purported to be less harmful, and certainly that's what people inferred from the marketing. But it turned out not to be the case. And is this a replay of that, or is this truly a line of products that truly reduce harm? And that's the fundamental question, and data are beginning to be collected, but it's not at all simple. All of you are familiar with e-cigarettes, and the basic principle is that liquid nicotine is heated in a device and creates a vapor, and this vapor is inhaled rather than smoke. So there is no combustion, and most of the data show that there are fewer toxic byproducts in these e-cigarettes and ENDS than there is in traditional cigarettes. There's a whole variety of products that look like cigarettes, and other ones that are tanks that have more ability to manipulate the temperature and the amount of nicotine that is in the liquid nicotine. But fundamentally, the concept is to inhale a vapor or an aerosol as opposed to inhaling combusted smoke. And then to put it together, I mean, what the real question is that from an individual perspective, smoking, as I've said, is the leading preventable cause of death, that our current methods are good but not great. They're not really going to get us to where we'd like to be, and that if properly regulated, e-cigarettes have the potential of providing nicotine with much less harm than traditional smoking, and that's exciting if that were true, and that's what we're trying to sort out. And again, from a population perspective, and this is what the FDA needs to make a determination on, is a population impact of these products, which hopefully they will be regulating in the not too distant future. There's concerns about youth initiation, that smokers will actually do both, smoke traditional cigarettes as well as use these products, that people who would have otherwise quit may delay cessation because they're dual using both products, that there may be different health risks than what we see with traditional smoking. You'll see later in the presentation there's some concern that ex-smokers may go back to nicotine who have given it up, and then after they're back on nicotine, whether or not they go back to smoking traditional cigarettes is unknown. There are concerns that all of the effort to denormalize smoking with restrictions on where smoking can occur, and not in planes and not in restaurants and not in the workplace, could be undermined through these products, which are being advocated to be used anywhere at any time. There are issues around addiction and whether we are comfortable with continuing an addiction, or whether we care or not what people do. And then, one of my concerns is this consistent with what we would consider to be a health-promoting behavior, having people addicted to a chemical that is not benign and has adverse effects. It's just simply better than smoking. And so you need to weigh these two perspectives in terms of almost certainly individual benefits for people who totally quit combustion and use these cigarettes versus possible population harm. And many are struggling with the answers to these questions. So in the rest of the presentation, I just want to show some of the evidence, some of the data, realizing it changes literally on a daily basis. I won't say a lot about teens. I feel uncomfortable speaking about teens in the Center of Teen Tobacco Research here at UT Austin and the School of Public Health and the Dell Center. And our project that we're working on is strictly on adults, but I'll just highlight some of the obvious. We are seeing, as all I think are aware, that there's a dramatic increase in teen use of electronic products, both in high school and in middle school. There are data coming out showing a tripling of the use of e-cigarettes among never smoking youth from the National Youth Tobacco Survey. There's a substantial number of teenagers who have never smoked or starting with e-cigarettes, and what their trajectory is totally unclear, whether this will come and go or whether it will lead to traditional smoking or dual use. And you can see here for the first time, I mean, it's silly to say for the first time ever because these products never existed before, but teenagers in the United States today are more likely to use electronic cigarettes than they are traditional cigarettes, and which is nearly unbelievable. We don't know whether the rise in e-cigarettes has contributed to the decline in smoking or not. There's clearly been a gradual decline in teen smoking over the near term, but the more rapid decline recently, does it correspond to increase in e-cigarettes, is a very important research question. This is just some more data about the prevalence of e-cigarette use. 1 in 4 high school students, 1 in 13 middle school students, and it's not a trivial issue. Without even getting into the issue of the use of these devices for other substances than cigarettes, or other substances than tobacco. And there is concern separately about these devices being used for marijuana and other illicit substances, at least illicit in most of the states. Certainly illicit for young people. So all of this the issue of does it do more harm than good? Is it the solution for the future? Was kind of best reflected for me in an article a year ago in the Washington Post by Ruth Marcus, who in her headline of her story and also in the first sentence of her article used the word quandary, dilemma, and conundrum. And I was impressed that someone could use all three of those words in such a short period. But that really continues to reflect the issue and the contentiousness and the advocacy on both sides of it, of being both a panacea for the leading preventable cause of death, but also potentially a peril, given what we're seeing around teen use, and also the fact, undisputedly, that most users of e-cigarettes continue to smoke, and not knowing where that's going. So, what are the official entities saying? And as you know, the leading organization that provides recommendations on preventive services, the U.S. Preventive Services Task Force, in September they came out with their recommendation that said that they found the evidence of end use as a smoking cessation tool in adults or adolescents is insufficient. They said that the research just isn't there to have them make a recommendation for these products to be used for the purposes of cessation, particularly when there are pharmaceuticals that have gone through FDA testing and have been shown to be safe and effective, albeit at low levels, for cessation. So the Preventive Services Task Force isn't recommending it, and there are, when you look at the websites or the position statements of the leading health organizations in this country, including Heart, Lung, and the AMA, and even this week the American Academy of Pediatrics, none of them are recommending e-cigarettes for cessation purposes because the evidence isn't sufficient for them to do so. Now that's not saying it's ineffective, that's just that it's not. The evidence is currently not there. So it contributes to the quandary, dilemma, and conundrum that Ruth Marcus talked about a year ago. In the UK, however, there's a total different perspective. In Public Health England, which is the public health agency in the UK, they issued a report in August that they explicitly said that the current best estimate is that e-cigarette use is around 95% less harmful to health than smoking, and are recommending that e-cigarettes be used in the armamentarium to help people quit smoking by the National Health Service. And you can see what's happened with that. That statement, within days, was incorporated into an advertisement in a vape shop in London, stating the National Health Service says that 95% safer than smoking. And so there's lots of issues with this, including the 95% estimate was not an empirical finding, but an estimate based on expert opinion. And then it's being translated into a fact in advertising. Again, not helpful in communicating the facts, not to say that there might be a role for it, but certainly there isn't any evidence that it's 95% less harmful. When we look at the data, and this data comes from our work at Georgia State, where we did surveys in 2012 and 2014 about whether people perceive e-cigarettes as being less or more harmful than traditional cigarettes. If you look at the right-hand columns, in both years, the modal response is that over 56% of people said they didn't know in 2012, and in 2014, 35% of people said they didn't know, which is the most common response, and not a bad response, but it's rare that you get don't know. Usually don't know is a throwaway category on surveys. Here, that's the norm, is that people just don't know, and it's part of our responsibility, I think, in the public health community to conduct the type of research that begins to answer the question so that people can get the best information to make decisions that will improve their health. This is additional data from our TCORS research at Georgia State, qualitative data, which we find actually in this instance to be very informative and perhaps more informative than the quantitative results. But when you ask a survey respondent what word comes to your mind when you hear the word cigarettes, these are the responses. And you can see, I mean, it kind of jumps out at you. Cancer is the leading word that comes to people's mind, with death kind of hidden inside the C and cancer, but all negative: smelly, dirty, nasty, bad, disgusting, gross. This is how people think of smoking. And you say, well, why do they use it? Well, it's simple. They tried it as a kid, and they became addicted quickly, and now they can't stop, even though there are more ex-smokers than current smokers in the United States. Most smokers want to quit. So that's the word cloud, and the size of the word corresponds to the frequency in which it's said for traditional cigarettes, and this is the word cloud for e-cigarettes. And you can see, kind of a fundamental difference. It's hard pressed to even see cancer on here. You see cigarette, they equate it to a cigarette, or they use words like vapor and smoking. But you also see words like, fake and stupid and things. So, but fundamentally, you don't see the health issues that you see with traditional cigarette smoking. And, this is probably, pretty accurate in terms of the reality. It's just the messages that people are getting are very inconsistent and inconclusive, and what we certainly, and I'll say later on, is that we want to avoid dual use, where people continue to do both, even though some argue that dual use may have some utility in providing a transition from smoking to e-cigarettes. There are no data to support that. And then there are unintended consequences, and this is one of them. This is a picture of a new sport called cloud chasing, where vapors try to exhale the most vapor they can from their lungs. And it has nothing to do with smoking, nothing to do with cessation, and it's simply recreational use, kind of bizarre recreational use, but nonetheless recreational use of these products to see how much they can inhale and then exhale. And, it always kind of stymies me how people are so willing to inhale substances into their lungs without any apparent concern about harm. But I guess we've conditioned people to accept smoking as a normative behavior for a century. So this is maybe an outgrowth of that. So there's recreational use that's occurring. And then there's a huge problem with marketing of these products. And I'll show you some examples, but the fact of the matter is that it's legal for e-cigarettes to be advertised on television. If you're born after the year 1971, you've never seen a tobacco product advertised on television. It was prohibited by law in 1971, and now it's legal for e-cigarettes to advertise on television. And they are very aggressively, because they can, and they want to do it before they're regulated. And so there's this window of opportunity. And they advertise their products like cigarettes have traditionally advertised their products, using beautiful women, sex appeal, famous spokespersons, etc. So I'll show you a little bit about this, and I think, again, most people would agree that this is inappropriate and somewhat of a disaster from a public health standpoint. Others say, well, I have the First Amendment rights of freedom of speech and I can do what I like. But what you see, I mean, they couldn't have picked a worse spokesperson in my mind. This is Jenny McCarthy, and she's the anti-vaccine spokesperson, and she's been hired by Blue Cigarettes to represent that product. And she is, there's a video here which I won't show you now, but you can check later. She is representing Blue on Comedy Central and other cable networks commonly. And so the manufacturer of Blue Cigarettes at the time was Lorillard, and since then, just recently, has been sold to Imperial Tobacco in the UK. But in a letter to the FDA, the president of Lorillard said responsible e-cigarette manufacturers, including blue e-cigs, do not market to youth. And this was their response to the FDA deeming regulations. They wanted to be explicit that they do not do that. They are responsible and they do not do that. So let's see what responsible marketing looks like to an e-cig company. Here's again, Jenny McCarthy on their website to provide more information. And you can see the brown cigarette with the little blue light at the end of it. But here's what the president of Lorillard wrote in October of 13, and here's the ad that came out in February of 14, which was 4 months later. And this was the ad in the swimsuit edition of Sports Illustrated for blue cigarettes. 4 months after the president wrote to the FDA about responsible marketing and how they don't market to kids. Well, we have data about the popularity of Sports Illustrated swimsuit edition among adolescents, and it's quite dramatic. And so the marketing has been offensive and not responsible, and hopefully FDA regulation will begin to change that. But that's just one example. Another example is another company that called NutraCigs that doesn't market their e-cig in terms of cessation, which they couldn't because they can't make health claims, but they do market it in terms of supplements. And so there's one product that will make you slim, another one that will give you energy, and a third one that will help you sleep. And so supplements are pretty unregulated, and the FDA is precluded from regulating supplements in this country. And so there are e-cigarette companies filling this void by selling these products in the context of helping you have a better life. And this one was one of the ones I was most concerned with, and this is a company called Fins, and it's a little hard to see in the ad, but the ad basically in the window of the diner says "Welcome back," and so who are they welcoming back to what? And I think it's pretty clear that they're welcoming back smokers to nicotine at the least, if not to ultimately smoking, if that's where they go. There are 53 million ex-smokers in the United States, and I'm one, and I like smoking. I like nicotine. I gave it up because I knew it wasn't good for me. But welcome back is a pretty evil campaign, in my opinion. So you have the marketing environment, which makes this even more complicated than simply the scientific environment. This is the last example. This is another product where they are not marketing it to help people quit. They're marketing it to beat the smoking bans, to use this as a product that can be used when you can't smoke, and experience the freedom. I find it always ironic that tobacco companies would talk about freedom when they're selling addiction, and it's really we get too accustomed to things that are really we shouldn't. I will pass on that slide. Simply, it's a broader view of regulation, and it'll be part of the archive PowerPoint. But what I want to do is kind of wrap this up and talk about where we are from a policy standpoint and what we have to look forward to. In 1994, David Kessler, then commissioner of FDA, indicated his intent to regulate tobacco products, and it was when the federal regulations were issued. That very day, the FDA was sued by the tobacco companies, saying the FDA didn't have the authority to regulate tobacco products, and it went through a legal proceedings, wound up in the Supreme Court, and in 2000, Sandra Day O'Connor agreed with the tobacco companies and said the FDA didn't have the authority to regulate tobacco products, but it should, because it's the leading preventable cause of death, and they should do it, but Congress has to give them authorities. And so that was in 2000. And those of you who are history buffs, you would think that if the Supreme Court tells Congress to do something, they would do it or consider it, but that did not happen until 2009. Nearly a decade later, Congress passed a bill giving FDA authority to regulate tobacco products that was signed by President Obama in 2009. And since that time, the FDA has been working towards fulfilling their statutory obligation of regulating tobacco products, and have proposed to extend their authority beyond what's in the statute, which specifically called for the regulation of cigarettes and smokeless tobacco, and to electronic products, as well as little cigars and cigarillos and hookahs. And that process has been ongoing for the last 18 months. And just last week, the FDA sent their final proposed deeming regulation to the OMB for approval, and OMB has 60 days to determine whether they will allow FDA and in what circumstances to go forward and regulate e-cigarettes. So as of today, there is no federal regulation of e-cigarettes at all, which allows the type of advertising that we just looked at. And so because the FDA hasn't been able to act on these products until they have authority to do it, the balance of action has shifted to state and local jurisdictions. And there, as of the summer, 170 municipal jurisdictions in 3 states have passed laws restricting the ability of, basically treating e-cigarettes like cigarettes and other tobacco products, and having to follow the same laws about that. But this is very heated argument as to whether e-cigarettes should be treated like traditional cigarettes, or whether they should be treated preferentially to encourage people to use them with a preferential tax policy and preferential advertising and preferential usage. And again, contributing to the confusion, both in terms of what the best policy is, but that it's going to be different in different states without any federal oversight. So what needs to happen next? There clearly needs to be a regulatory framework that oversees this issue, that exclusive use of non-combusted nicotine products is certainly preferable over traditional smoking, but that's not happening right now, in that the majority of use is dual use. But there are both research going on, as well as exciting opportunities of not just looking at e-cigarettes regulation in isolation, but looking at e-cigarette regulation in the context of making tobacco, cigarettes, traditional cigarettes, less appealing, less addictive than they are today, including possibly reducing the nicotine level in cigarettes to levels that are non-addictive. And there's a lot of exciting research going on there. And we also need to avoid unintended consequences, as we discussed today, around youth and dual use and smokers returning to nicotine, and all of the topics that we said. And that I think many of us feel that we need to look at this even in a broader context of health promotion. And what kind of society do we want to have? What's the right level of addiction, if there is a right level of addiction? And how does this relate to laws around marijuana use and other deep questions? Let me just conclude and open it up for questions by saying, as the popularity of ENDS increases, one of the positive benefits is that more smokers are thinking about quitting. We know that most smokers wish they didn't start, would like to quit, but the e-cigarettes has created a dialogue that smokers may see this as a way to rid themselves of a habit which they'd rather not have. And Consistently 70% of smokers regret smoking and would like to quit. So part of our obligation, I think, in the public health community is that we need to capitalize on this unprecedented interest in quitting and communicate the best information available to help smokers make informed decisions. And that could vary by the individual. But right now they're getting a lot of confusion. They have a lot of don't knows. They're getting mixed messages. And that's not, I don't think, serving anyone well. We do know that there are effective methods to stop smoking that have been approved by the FDA and now, started out as prescription and now are over the counter in many instances. But also we need to recognize that they don't necessarily work across the board for as many smokers as we'd like, even though they are safe and effective. And at the same time, there's very little evidence about the safety or the efficacy of ends. We'd like to believe they're effective tools in smoking cessation, but at this point in time, the evidence really isn't there, as is reflected in the clinical preventive services task force recommendations. We need to advise smokers to avoid dual use if they are to try e-cigarettes, unless at some point there's evidence that dual use is therapeutic and that there's a valuable transition where people do both for a month to allow to go to e-cigarettes, but that evidence isn't here. We need to be cognizant of the individual benefit and the possible population harm as we go forward. But fundamentally, I'd like to end on this, is that we need to use this public discourse on ends to further discourage smoking and to support other tobacco control efforts, because despite how successful we think we may have been, there are still over 40 million smokers in this country, 35 million of whom would rather quit smoking than continue. So let me end with that and turn it back to you for questions.
Well, Dr. Eriksen, thank you so much for a wonderful, wonderful presentation. At this time, we'd like to invite people to type their questions into the questions box. We're still waiting for some questions to come in, and Dr. Perry will be moderating those as they come in, but I think we've got one to start here. If you want to go ahead, Dr. Perry, I'll hand it to you.
So yes, Dr. Eriksen, I was wondering what you think in terms of, say, state and local regulation. What do you think is the most prudent action right now vis-a-vis e-cigarettes? Should we just let things go and study what happens, or do you think we should have regulations similar to cigarettes until the data come in that confirm? So, so what do you think in terms of what do you think is the best action strategy?
I think in the absence of data, and based on court rulings, and the relevant court ruling here is that Judge Leon determined that e-cigarettes should be considered tobacco products because the nicotine is derived from tobacco, and therefore they should be regulated under that part of the FDA law. So, in my opinion, the extant law on this is that they're tobacco products, even though people will furiously argue that they're not, that they should be treated as tobacco products by state and local jurisdictions, and they should be not allowed to be used where tobacco products can't be used. They should be taxed like tobacco products. They shouldn't be allowed to be advertised like tobacco products. Whatever rules apply to tobacco products should apply to e-cigarettes at this point in time. And as evidence comes in that warrants a change in that, it should be reconsidered. And I know people will be furious over that because they feel that that's the absolutely wrong answer, and my Twitter will be exploding on this because that people feel that they should be given preference, but and that people should be encouraged to use e-cigarettes because they're manifoldly less harmful than smoking. But at this point in time, what we're seeing is kids starting and smokers using both.
Yeah.
Well, it appears you gave a almost perfect presentation here because we're lacking questions from our audience. There's not a lot coming in. I really would like to encourage folks to type in their questions in the question box and submit them here to take this opportunity to ask an expert on this. But Dr. Perry, do you have anything else that you think we'll give people a few more minutes here to type something in if they want to ask? But any other questions or things that we could discuss here? Oh, actually, we've got a question, sorry. This is from Joanne Dell, and it says, in terms of preventing the onset of youth tobacco use, what do you see as low-hanging fruit that our research can focus on here in Austin at our Michael and Susan Dell Center?
Well, I have a little sheet here of research questions that I scribbled on one of my airplane trips, and there really are important research questions that I'm afraid aren't even being investigated, and that's what the most disturbing part of this is that even though the FDA has a robust research portfolio, some of the issues that really need to be answered, I'm not aware that they're actually being investigated. For instance, one is, has the use of e-cigarettes by teenagers contributed to the decline in smoking rates, or are they simply ecological correlations? But is there a nexus where one is contributed to the other? And I'm not exactly sure how you answer that question, but I think that's an incredibly important question that could be investigated by people smarter than me, who can use cohort analysis and statistical techniques to look at causal pathways and what relationship that may have. The other important question that we don't know is about dual use. Some people, on the surface of it, dual use is a disaster because all you're doing is getting more nicotine. And the data that I've seen on it shows the average reduction in the number of cigarettes per day has gone from 14 to 11, which is trivial because cutting back on the number of cigarettes is not really beneficial to your health because you can compensate. And so research that would look at the utility of dual use and say, is there a period of time in which dual use is appropriate that will facilitate the transition from combusted to electronic products? But I don't even know anyone doing that. And then, I don't know, I have to say, I don't know that there is sufficient research being done on clinical trials to look at the efficacy of e-cigarettes as a smoking cessation aid. There have been a couple of studies, but again, people smarter than me, the Preventive Services Task Force, concluded that the data were insufficient. So just like the Supreme Court saying that the FDA doesn't have the authority, but Congress needs to give it to them, and it takes 10 years. If the Preventive Services Task Force says the data are insufficient, that to me says there should be research to make the data sufficient, whatever that outcome is. And then I think just lastly, to me, from a public health standpoint, is that we need to figure out how to communicate with smokers to help them rid themselves of a habit they don't want to have, and which is killing them. And we haven't done bad in that instance, but to think that in 2050 we'll still have tens of millions of smokers when we know that it's going to kill 1 out of 2 lifetime smokers is unacceptable. We really need to do a better job of how do we communicate to smokers and help them rid themselves of a habit they don't want to have.
We have a couple more questions now. Alex Prokhorov from MD Anderson said there are hundreds of flavors of e-juices. Some of them are positioned as organic, almost healthy. How much do we know about these ever-increasing flavors and their toxicity?
Yeah, and the TCORS are looking at flavors, and what they're finding is that some of the flavors are really bad actors. And we heard one presentation where one of the universities was looking at flavors, and they put the flavor, I think it was called atomic cinnamon. You may remember that it actually melted the petri dish. I mean, it was like so toxic, and so I don't know what the chemical reaction was, but it was like it was dramatically worse than the other flavors. So flavors. And the other thing with flavors is that the industry says that these flavors are GRAS approved, and GRAS is a FDA term, GRAS, which stands for generally recognized as safe. Well, that's safe and added to food, but it's not safe heated to create an aerosol and inhale directly onto the lung. It's not tested in that way. So, there's a lot of questions about flavors, not to mention the issue that they are appealing to young people. And even though, again, my Twitter feed will say they're also appealing to adults, that's fine, but they are particularly appealing to young people. And then there's a whole issue of poisonings and not having childproof caps and not having warning labels because there is no regulation. And the industry realizes this, and they see this as a liability to clean up their act around flavors, but that hasn't happened consistently yet.
So do you think there's enough that we know about that e-cigarettes should be included in school-based prevention programs? Tobacco use prevention programs, smokeless is in there, cigarettes. Should kids learn about the health consequences of e-cigarettes?
That's a great question, and I don't know, I certainly don't have a great answer, because I don't know what we'd say. I mean, other than to say that smoking is really, really bad, and the average smoker starts as a 14-year-old. I mean, Cheryl, I'm sitting next to Cheryl Perry, who, authored 2 Surgeon General's reports on smoking in youth, and is, the world expert on the topic, and how you, effectively educate kids about smoking is complicated, and then to add into that around e-cigarettes, I'm not sure what that message is, except to be truthful and tell them what we know and what we don't know yet. And then, then it gets into issues like addiction, and is addiction consistent with a life of promoting health? And I have some concerns about that. I mean, we want people to be physically active and eat well and treat people with respect. And do we want to be condoning addiction with a product that is not benign just because it's better than smoking? And how do we work through that? Deserves another issue that deserves a lot of attention, I think, from National Health Education Associations and other people who care about the welfare of young people.
Okay, well, it looks like we're just about out of time, and we are going to go ahead and call it there. I want to thank our guest, Dr. Eriksen, again, and Dr. Perry for moderating here today. Just a reminder that this webinar was recorded. We're going to put it on the Michael and Susan Dell Center for Healthy Living website, which is msdcenter.org, and you should look for that up there in the next week or so. But thank you, everyone, for attending. I hope you enjoyed it, and we will see you again soon.